guys, welcome back to Medical Coding with Blue. Today's episode is all about jobs to avoid if you are a brand new medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so the thing about applying for jobs in medical coding, obviously you're going to run into a lot of we want experience and how are you supposed to get experience if no one will hire you. So sometimes you may be forced to take other positions that are not medical coding to try to get your foot in the door. Now I'm going to talk about 4 in particular today these are needed positions, obviously in the medical field. However, because they don't require the things that we have to know as medical coders, I don't recommend these for people who are trying to look for alternative positions to getting in. I will do another episode about that later. But I want you guys to know that if you're trying to get in and you say, well, I want to take this position just to try to get my foot in the door, you may get stuck there. I have seen people get stuck there and they apply for these positions. One in particular, they're like, oh yeah, and they ended up being there for 2 years. Meanwhile, all the time that they're in that position, they're slowly forgetting all the things that they learned about medical coding. A lot of times when people are taking these alternative positions, they stop studying, and that's the #1 mistake that you can make as you're someone who's trying to get out there and try to find a job. It is possible, guys, to find a job in medical coding, even without experience. I know because I did it. There's a lot of people that do it. And it's just one of the things in the industry. Do I wish it was different? Of course. But then I always tell people, let's be prepared then. Let's go ahead and try to do the most work on ourselves so that way we can give ourselves the best shot at getting in, right? So with that said, here we go. All right, so the first position to avoid, medical receptionist. So a lot of times there's going to be, a lot of positions for a medical receptionist because it's a lot being a receptionist. You got to answer a lot of phones and you've got to do a lot of greeting of the patients and things like that. And so with that comes a lot of patients getting upset with you and you're getting yelled at a lot and you're getting attitude from people on the phone and that kind of thing. And with that, nobody wants to be in that kind of position very long. However, there are some people who are really good at it because they're people, right? They're a people person. And so because of their good mannerisms, they often get kind of stuck in those positions because if the employer knows that you are a trained medical coder and you're in a receptionist position and they like you there and the patients like you, you are less likely to be able to get transferred within house without some kind of pushback from your employer because they're going to want to keep you in that position. It does happen, guys. It does. Should it happen? Absolutely not, but it does. And so because it does, I want people, again, to be prepared for this. So this is why I say if you're a really good medical receptionist, you may end up staying there a really long time and you don't want that. If you're already in that position, It doesn't mean that you stop looking for medical coding positions. Okay. So that's why I say medical reception has a completely separate skill set that they need, not necessarily the skill set that medical coders have. We have specialty training. We have medical terminology and anatomy and medical law and ethics, and we know medical coding. So that requires more from the position, not just working in a receptionist position. That's my thoughts there. The second one is secretary. So sometimes people say, well, it's more of the inner workings. This is different from being a receptionist, right? It's the same thing. It's not requiring the knowledge that we have to have. Do some medical secretaries select the codes and things like that? Yes, they shouldn't, because especially if they don't know what they're doing. But this happens more than people know. And a lot of times these doctors, they think that they know the codes and they think they know which codes to select and they know all the rules. And when in actuality, they don't. So that's why I say it's important to have somebody in there who's professionally trained or who has passed a certification exam like a medical coder doing the coding side, not just somebody who's being a secretary and given that responsibility. And selecting codes on a paper does not make you a medical coder. That's not coding. And the same thing for my nurses who think that, oh yes, I do coding. No, you don't. If you're circling from a super bill, that's not coding. Coding is when you're looking at the documentation, you're abstracting diagnoses, you're looking at what level this should be, or you're looking to see if this is appropriate for a procedure code and that kind of thing. That's medical coding. So yes, while sometimes the codes are already selected, it doesn't always mean that those codes are correct. That's when the coder comes into play, right? And if you are hired on as a secretary and they know you have this background as a medical coder as far as like training and you just got your certification, don't think that they won't try to use that, all right? That's a skill that you have, and that makes you more advanced than just your regular average medical secretary. You have knowledge about the codes, and especially if they don't have a medical coder, then you may be taken advantage of, guys. So you have to be very careful about the positions that you apply for. And again, having a position as a medical secretary is not going to go far on your resume other than the fact that you've worked in a medical setting before. It doesn't necessarily mean that what you have done is going to translate into the medical coding. Again, if you're circling from a super bill, that's not going to translate very well. Okay, so that's just what I'm saying there. I want the time that you are out there looking for a job and you get a job to actually mean something. Now, again, I'm going to do a video about the alternative jobs because those alternative jobs are going to give you exposure to coding. And that is something that's going to be easily transferable and is easily going to give you a leg up versus somebody who is not experienced either, or doesn't have as much experience either. So I'm just leaving that there. So no to medical receptionist, no to medical secretary. Okay, just my advice. The next one, patient access. So there's a lot of times where they have a position for patient access, and usually this person is sort of like a receptionist, but they also gather paperwork and things like that, and they send the people off to just different places in the hospital and that kind of thing. And you'll usually see them in the front. They'll greet you, and then they'll get you processed in and then get you to whatever department you need to go to. So some patient access positions are like that. Others entail different things. But again, what element is missing? Coding, okay? So that's why, again, I don't really recommend something like patient access, because that's just a way of getting in the hospital, yes, but it's not going to take advantage of your skills. It's not going to, well, you are not going to be able to have the advantage of applying your skills in a position like that. Okay, so again, that's just another position that I would avoid, only because, again, the clock is ticking. And the more you're out of school, the longer you've been from the time you got certified till the time you find a job, that's just time that is just ticking away. And a lot of people will stop that studying. And again, guys, you can't stop studying. You have to continue to study, because if you're not around it, you're going to just forget it. And that's not a good way to be, especially when it's maybe a year or two down the line and you still haven't gotten a job yet. And if you're still applying and you're not getting any kind of responses at all to your resume, then that means that's a big clue that your resume needs to be looked over and that you possibly do need help. Now, I do have resume tip videos. I will leave those video links in the description box below. You can hire somebody to rewrite your resume. I rewrite resumes myself. My rate is in the description box below and how you can contact me for that. But I want to stress this point the most, right? Not just because I rewrite resumes, but because I want you all to be successful. That can stop people from trying again and again, is if they're not hearing back from the employer. Now, if they're not hearing back because you wrote your own resume, you need to look at it. Follow the tips in my tip video. And if you feel like you just can't write it yourself, then obviously get some help with it. But that's the thing that you need to know. Those resumes and the cover letters go a long way. And if people are telling you, oh no, you don't need to do a cover letter, no one reads them anyway. No one reads form letters. Okay? No one reads form letters. That's what they don't read. That cover letter does not need to be a regurgitation of your resume. What it needs to add on is those soft skills that you can offer to that employer. That's what needs to be covered in that cover letter. Not the fact that, you are looking to be trained. If you're also saying that in your resume or your cover letter, that's a big red flag, and employers do not want to see that. Okay, so again, that's what I would say to anybody out there that's running into this trouble. And then I just said not to apply for these other positions, and they're like, Bleu, what am I gonna do? That's what you do, guys. You get a really good resume together, and that's how you set yourself up for success. And again, I will be doing another video about what positions that are alternative to medical coding that you can apply to, and that way it'll help you to get in, okay? And the last position that should be avoided is referral coordinator. So referral coordinator is somebody who gets on the phone and it's a needed position, okay? Hold your fire. It's a needed position, but it's not going to exercise your medical coding skills, okay? This is basically telephone work. You're getting on the phone with the patient, and you're getting on the phone with like the insurance and all this other good stuff. So you're working with the doctors. So it's having all of that communication, yes, but it's not going to exercise your medical coding ability. And again, if you get really good at being a referral coordinator, they're not going to want you to leave that position. All right? So that's the thing that you have to keep in mind. You know, if this is how you got in, great. Okay? Great. Although I would question, why are you watching the video about what positions to avoid, all right? If you're already working as a coder. But these are the ones that I say to avoid, because again, you want to make the use of every single day that you are out of your school and that you've gotten your certification. You want to make good use of every single day. When I was looking for my job, my first coding job in medical coding, it was 2 months before I got my first job, and only because I was relentlessly out there looking and looking and looking. And it wasn't until my mom's like, you need to go back to the school and see if the principal can help you, because I wasn't finding anything. Everybody was telling me the same thing. You know, you need experience. Come back and apply with us again when you get experience. I don't want to do that. So the principal had a friend that had her own temp agency, and it was temp agency for medical professionals. You can find the temp agency for medical professionals in your area simply by doing a Google search, guys. There's not one that's a national branch, all right? So you just have to go to your area, and you have to Google, you know, temporary agencies for medical professionals, and you will see them pop up. And you'll see that sometimes they'll have positions that are just going to be for like a few months, you know, just for a while for medical coding. And that can be used on your resume to augment your experience, so that way you have something, okay? It's not going to be the 2 to 3 years of experience, the 3 years, 5 years of experience that they want, but it's going to be something to get you started, all right? And all of these things add up, and all of this experience adds up. And sometimes these employers will use the temp agency to kind of like ferret out who they want and who they don't want. So it's like a try before you buy, right? And they're going to be like, okay, well, you know, this person is really good. They have a really good work ethic. They really know what they're doing. They're a fast learner. So we're going to go ahead and keep them. And that's how it works sometimes. And sometimes it doesn't work out. Sometimes personalities don't mix. And so they'll say, well, you know, this person tried, but we think we need somebody else, you know, and that's okay too, guys. If it doesn't work out for you at a certain place, there's a reason for it. Okay, I've experienced this myself. When I got my first job in medical coding, and it's at the Cancer Therapy Research Center, I was competing against 2 other ladies, right? So there was 3 of us all together, but they needed 3 of us to help get their backlog down, and they said they were going to keep 1 person at the end. I didn't get picked. Now, it wasn't on technical ability, but I just didn't get picked. Was I disappointed? Sure, right? But there was a reason that I didn't stay at that position. I didn't like the supervisor anyway. You know what I mean? The supervisor was she wasn't a good lady, right? But it was okay. It was okay. I got from that experience what I got, all right? And it wasn't that, you know, I didn't get anything from it. I certainly got a lot from it. I got hands-on E&M experience, diagnosis coding experience, and of course procedures. And that helped me to get my next position, right? Which was also through the temp agency. And that was for a professional fee coding position. So with that said, that's how I was able to get in. And that's how I would suggest that you get in as well, guys. I mean, it's not going to hurt you to apply with a temp agency. That way you have another person out there advocating for you to get a job, because if you're getting paid, the temp agency is making money, and that's their goal, is to make money. So if they want to make money and you want to make money, then everybody's happy when you get these jobs. And taking assignments from them, you know, whatever the assignment is, you know, again, it's going to get you that exposure. It may get you exposure to like the electronic medical record and other things that would be helpful for your resume. So that's why I always suggest going to the temp agency. All right, guys, that's just my advice anyway. And the last thing that I will say on this video about jobs to avoid. The other job to avoid is the coding job, where the coding is over 150 per day. If the productivity is over 150 per day, that is not a coding position. That is a data entry position. There's a lot of them that are doing charge entry, right? Because they already have the codes there. But those codes are not always going to be correct. It doesn't matter who's selecting them. Doesn't matter if the doctor's selecting it. Doesn't matter if it's the electronic medical record. Again, that is going to be all wrapped up into, oh, the doctor says that they know, right? They say that they know what codes to use. But they're not trained medical coders a lot of the time. Yes, there's some doctors that are trained as medical coders, so you'll see them out there, which those guys are awesome, right? But it's not always the case. And sometimes they get their training from like a one-day seminar, and they think they know, and they say, okay, I want these codes. And then the coder is like, doesn't know to say, oh, okay, well, okay, this is my first job, so I'm going to do whatever they tell me to do. If those codes do not match what is documented on that record, you cannot pick it up. It needs to be queried, or you need to select the appropriate code, because we are bound under ethical standards to be able to do this. All right. And it's not going to be, well, the doctor wanted it, because when those things come to call and they do those audits, and they're going to say, well, who coded it? Oh, it's the coder who coded it. If you say, oh, it was a doctor that wanted those codes, that's not an excuse. And that's not going to get you off the hook either, because you're responsible. Everything that we touch, everything that we do, we are responsible for, because we are the professionals and we are certified medical coders. We are supposed to know. All right. There's a difference in you're just going along to get along. You can't do that. Not with medical coding, guys. Not with medical coding. And if they get upset with you, the place that you're working, they get upset with you. They say, no, we want this. And you know it's wrong. Then you have a responsibility to say no. And you can always find another job. As easily as you could find that one, you can find another one. All right, guys. So that's what I would recommend. There's a lot of things that you can do while you're out there looking for a job. Obviously, you can do other jobs. You can continue to work wherever you were working at, or you can do other things. You know, when I was looking for a job, I was still cleaning houses. I was still working at the halfway house. I was still working at the bar. I was still working 7 days a week, trying to keep myself financially stable and my head above water, because I'm still going through a divorce. I'm still going through all these personal things at the time. And then so it was just like, okay, I've got all these things going on, but you know, I need to keep it together. So that's what I did. And that's what I encourage all of you to do, because there's been people I hear from that they say, well, Blue, I'm not working right now. I really need a job. Then they get desperate. Then they go into these positions where they're not really coding, and they're calling them a coder, right? And so making them code over $200 or $300, $200 or 300 encounters per day. I heard from one person who said, oh, that they can code 600. That's not coding. No. You're data entering. 600, you're data entering. 200, you're data entering. That's too fast. Coding involves diagnoses, procedures, modifiers, evaluation, and management. It includes all those things, right? And you need time to be able to do that. So those are the things that you need to look out for, guys. I'm here trying to help you all. If you disagree with what I say, that's fine. But at the same time, I want you to know that this comes from experience. And while you may have a different experience, your experience may not be what is all the time, right? That may be 1 in a million shot that you had, that you got in, or that you were able to work one of these positions and it worked out for you. But this is not the case for everybody. That's why I say that there are certain positions that you can get in that will help you with your medical coding journey, and it will keep you learning. but these positions are not those. I'm just saying, okay? So with that said, I'm going to go ahead and wrap this one up. But if you're out there on your journey, guys, just keep looking. All right, keep looking. And if a certain place doesn't want to hire you, that's all right. There's a ton of other places that you can apply. But open your eyes and open your mind to just different things that you can do as far as like trying to get in, right? And again, I will talk about this in another episode. But again, these are the ones to avoid. And when you're out there, look for positions that are in coding, that are going to have a reasonable productivity rate. If you can get higher than that when you're on, then that's perfectly fine, right? If you can get higher than 150 because your clinic was maybe easier, or your providers are trained really well, or you've got them really well trained, and you're able to just kind of really get through these encounters, then that is great. But if you're out there and you're just barely trying to be like learning and things like that, between 80 and 150, that's reasonable. Anything higher than that, don't even bother, because to me, that's just a data entry thing, and that's not even coding. I'm just saying. So with that said, I'm going to wrap this one up. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.